Hi, good morning. I'm talking to Uri Schneider. Uri is a speech and language pathologist. Hi, Uri, how are you?
Good. Good morning, Joanne. Great to be with you.
Uri, can you tell me a little bit about what is speech therapy? I know there are other names such as speech language therapy, voice therapy. Which is it, and what issues can you treat?
Great. Well, first of all, it is pretty confusing for a lot of people. What are the different names? And some of it has to do with what country you were trained in. So in England, they've got one name, in South Africa another, in the United States another, and in Israel another. So speech-language pathology really covers the scope, a very broad scope, of speech issues, which relates to anything that has to do with the mouth, articulation, enunciation, the voice, the quality of the voice. All of that is speech. And then language has to do with vocabulary and grammar, how we express ourselves in speaking, how we express ourselves in writing, how we understand each other in our listening, and how we understand each other through the written word as well.
And who are you able to help?
Also, a really broad scope, and it's really important, I think, as a person is looking for a professional, to really look for a person who not only has the title and degree, which is important, but also has the training and the experience and the expertise dealing with a particular age and the particular issue that you're looking for help with. So in our practice, we work with the lifespan from preschool children. Some people even work with infants with swallowing and feeding issues. I begin working with preschoolers, even at that first word stage, with youngsters who are late to develop language. All the way up through the preschool years, into the school age years, teen years, early adulthood, and so on. And the issues range from feeding issues, developing those first words, speech that is unclear and hard to understand in young children. Obviously, people know about a lisp, which is very common, developmental distortion in the speech. And at some point, it may become something that would benefit from speech therapy. Of course, there are issues with spelling or learning to read, written expression, organization. Older people may deal with issues that are secondary or comorbid with issues like ADD, nonverbal learning disability, Asperger's, autism. All of these diagnoses carry with them a language component. And then there are adults and younger people who deal with things like stuttering, which is one of the things we specialize in, voice problems, which affect children and adults. And then up through adulthood, there are people that deal with traumatic brain injury. They may fall off the bike or have a different head injury, or they may suffer from a stroke or some other event that causes damage to part of the brain that's involved in speech and language production. So it's pretty wide scope, and that's why it's really important to find someone who really has the training, the experience, and the capacity to help you with what you need.
And what would happen in a session? Are the sessions one-on-one, or would you group together, a few people who have issues with stuttering or lisping, for example?
It's a really good question. I like to tell parents or to tell people that there are really different ways you can receive the speech therapy that you're looking for. So, one way is in Israel through a Hitpatzchut Hayeled, or a child development clinic. And in that way, it's paid for by the Department of Health, Misrad HaBriyut. And in that way, you're often in a clinic and you're getting one-on-one sessions that are being paid for through the Kupa, through medical insurance. In other settings, you're getting speech therapy in a school. In a school, it might be provided one-on-one. The child is pulled out of class and given speech therapy with one speech therapist who works with them individually, more than once a week, or they may be done in groups. There's also the world of private therapy, where people go and find a professional of their choice, and those sessions look differently depending where you go. There are intensive programs where a person goes for an intensive period of time in a group. There are one-on-one sessions. Each therapist and each client and each issue takes a different shape, and hopefully a shape that helps the client feel that they're achieving their goals and progressing forward.
And Uri, why do you think children have speech and language difficulties? And can my child outgrow these difficulties?
Yeah. So I get to speak to a lot of parents. Often it's moms, sometimes it's dads. I think the better question is, why is it so many kids develop normally? It's pretty miraculous when you consider how many things need to click and be coordinated in their development. Just for a moment, just think about how fast you could clap your hands. As fast as you can. If you timed yourself, you probably wouldn't get faster than 2 or 3 times a second. The vocal folds vibrate at a rate of hundreds of times per second. So the hertz, if you measured your voice in hertz, you would find out the number of vocal vibrations per second. And when you think about hundreds of vibrations per second, being coordinated at different pitches, being shaped into different sounds, and being coordinated into something that's fluid and fluent, and thinking about the next idea, and having the right coordination of gesture and nonverbal language, and listening and responding exactly to what's been told to you. There are so many different layers that have to be clicking. I really think the miracle is that most kids develop typically, and these things come together, and along the way there may be bumps where it looks like things are not clicking perfectly, but that's very common, especially as there's a burst in one domain. The other domain may still be developing, which is normal, and as they come to a level place, we tend to see things even out. So certain mistakes that young children make, like calling a cookie a tutti, or small things like that, are very, very common, are very much part of the developmental process. And by that I mean that it's appropriate and it's expected and it's normal, and we want to just make sure that things continue to move in the right direction. That's a question that a lot of people ask very often, and at some point, if a parent or a child care provider or a teacher or a pediatrician kind of gives you the advice that you might want to check it out, or you bring the question to your pediatrician or child's teacher, that's a time to feel out, are other kids going through things like this? Is this something you've seen other children deal with? And at some point you may say, I want to speak to a speech therapist for a consultation, but most kids develop typically, and that's the miracle. And that being said, there are some kids that have little humps and bumps along the way in their development, and they definitely, on the whole, the majority of kids that begin speech therapy finish speech therapy. They don't stay in speech therapy forever, and for most of the issues that we deal with, especially common articulation problems, common voice problems, common late talking and later speech development, especially in a bilingual kind of a setting, a lot of those issues tend to iron themselves out. Other issues, for example, stuttering, an overall strength or weakness in language, those are things that are sometimes more likely to stick around to a greater or lesser degree. So sometimes the goals of therapy are to eliminate and achieve the full achievement of the stated goals. And at other times, it's about moving things forward in a more accelerated fashion than they would on their own, and moving things to a point that they're good enough, and helping the person continue moving forward in whatever path they need to, academically, vocationally, socially, but that all these domains continue to move forward and the speech and language issue is dealt with and they can continue to live life to its fullest and be all they can be.
Thank you, Uri. Thank you so much for talking to me today.
Pleasure. Thank you for the chance.